After 22 states sued this week, there's temporary block on Trump administration's plan to limit payments for costs associated with National Institutes of Health funded research. Penn State says it could lose more than $35 million if that goes into effect. The NIH policy would cap indirect costs funding at 15%. The university says that it would hurt its ability to do groundbreaking research. But the cuts would also impact many communities.
Like, there are plenty of places where the school is one of the largest employers in town, and this will really, really hurt communities.
Christopher Norbury is a professor and researcher at Penn State's College of Medicine. He researches within the Cancer Institute. His current NIH-funded research focuses on cytomegalovirus, which is carried by most of the population. It can be very dangerous for immunocompromised people. While research may not stop immediately, if funding cuts happen, the research will grind to a stop in a few months.
So that we will not be able to do anything in, 3 to 6 months.
The Trump administration calls the indirect costs overhead and says cutting it would save $4 billion a year. Examples of indirect costs acquired by the university are research security, specialized core facilities, subject protections, and much more. These costs do not produce income for research institutions. Getting a grant for these costs takes approximately 9 months to get approved, but you must plan further in advance.
I mean, if you're planning to try to get funded, you're planning 2 years out.
With so much uncertainty, Penn State is working with several national organizations to assess potential impacts.
A 5 to 10 year build back, assuming that, like, if this would happen for a year, it would be a 5 to 10 year build back. If this would happen for 4 years, then it would never come back, probably.
In University Park, I'm Sarah Grosch for the Center County Report.